so much for everyone who is able to join us tonight. And Juan, thank you for joining us as well. I'll jump right in. So I'm Jessica, and along with Betsy and the Research and Insights team at the Children's Media Association, we developed a report to highlight the teen mental health crisis because there is so much research, resources, and thought leadership regarding the teen mental health crisis that we really wanted to present it and make it readily available for people. We wanted to bring together youth who are mental health advocates so that they can speak to the report, their experiences, and really give us a little bit from their own opinions how we can move forward and make a difference with youth who are struggling with mental health. Going to introduce Juan Acosta. Unfortunately, Emma was not able to join us, but we're very excited because Juan Acosta is an advocate for underserved communities, specifically on the LGBTQ plus immigrant, Latinx communities. He has served on various national committees and speaks at conferences and festivals, including the United Nations side events and the first ever Youth Mental Health Action Forum White House event. He co-authored the New York Times Bestselling Channel Kindness, Stories of Kindness and Community with musical artist and actress Lady Gaga and other Born This Way Foundation reporters. So Juan, thank you so much again, and we are so excited to jump right in.
Thank you all for having me. It's great to be here.
So we would love to know how you got involved with advocating for mental health. What was kind of the day where you realized that, I gotta stand up, I have to do something? What inspired you to, begin this journey?
That's such a great and funny question because I really never wanted to be an advocate. I did not know what advocacy was at a young age. And for me, it became really a part of my survival to advocate. And I think a lot of people advocate without knowing that they're doing it themselves. My first thoughts back to my childhood was supporting my parents when they were going to the doctors and translating for them and asking for my parents for their needs. And that's something that stuck with me. But I began using my voice and trying to operate as a vehicle for change and using my voice for causes at age 13. And it was at a point where I was really struggling with my life. I didn't like going to school because I was being bullied and people were labeling me things before I was able to name them for myself, which felt really intrusive. And if you really add on the struggle of being an immigrant in this country, in addition to being a young kid in school being bullied because he was gay, it really impacted my mental health, the way I interacted with people. And I really didn't feel like I belonged to my community, the place where I was living in. And I really did not know what was going on with me. I started feeling sick. I did not want to go to school. I had stomach aches all the time, or at least that's what I told the nurse in order to get out of class. And I knew it wasn't normal for me to be feeling that way. And I knew there was something deeper that I needed to really find out what was happening to me. And that's when I began to volunteer at a local nonprofit called the Yola Family Resource Center. And I began to connect with other young people who were trying to make a difference in the community. I began to get definitions as to what mental health was, what depression was, what anxiety was, what it looked like. And I began speaking to counselors as well. And that was when my journey in advocacy was born at that age, specifically due out of my own lived experience.
That's amazing. The fact that you were able to recognize that you were struggling is a huge strength. And then it's really important to, be exposed to, whatever the definitions are, because otherwise you don't know. And that's the first step that you're able to, make a difference, get better. And I think that's really strong that that you were able on your own to, figure that out and take the initiative upon yourself to really, start your journey for getting better.
Yeah, and I mean, it took a while for me to really recognize that, and I think it takes a while for many people. I for years struggled behind closed doors, not wanting to stress my parents out with what I was going through, just because I really saw them work day and night to put food on the table. So it was a very real concern of mine to add on to all the things that they're already dealing with. But it came to a point because I was having suicidal thoughts and feelings at that age, and that's when I knew I needed that support and I needed to get help. But I think overall, what we can do as young people is to have that kind of safe space to speak about these things. And going back to the definitions and jargon that we use, it's some people don't know the definitions, but they can use descriptive language in order to describe what they're feeling.
So going back to that point of feeling scared to come forward, share how you were feeling with other people, I'm wondering, through both your own experiences that you've gone through, but then also now your work in this advocacy space, how are you seeing young people talk about mental health? And is there hesitancy or stigma around it? And how can we approach those conversations as peers, like in their friends, or as mentors in if we are in more of a power dynamic in that space?
That's a great question. I think there's layers to it. I think young people now are talking more about mental health. I see it on social media, I see it in the work I do, and I hear it from young people themselves. And I think it's great. However, there's still a stigma nationwide around the world when it comes to mental health. And it's something that we are constantly working to break, to get rid of. And I think what's most beneficial is to really model that behavior in our own friend group with our own families and talk about our own feelings in order to make others feel safe enough to do so. And I think what's important to know as well is that sometimes all people need to know and hear is that there's someone that they can go to talk to when they're feeling upset or when they're feeling down. And I think it seems like such a small gesture, but that can really save someone's life, just knowing that there is someone out there. Because when people are feeling lonely, they sometimes don't know that there is someone out there for them, someone who can hold their hand, who can really listen to them and just be there for them.
Yes, 100%. Sometimes we don't realize that even, the smallest gesture can make the biggest difference. I just want to echo that. 100%. Like always, should I reach out to this person? Yes, always reach out to this person. It will never cause any harm. Hey, how are you? They can choose to answer. They can choose not to answer, but it'll definitely get the conversation going. Maybe sometimes people will, take that opportunity to actually, have an open discussion with you, and it can really, go a long way. So, yeah, 100%.
Yeah, it's kind of like that open door policy if you think about it, right? Like in school, they tell us like open door, but I think it like applies to our own life as well. Once you kind of build that rapport with a person, once you know you have that relationship with someone, I think just letting them know that whenever they are feeling down, they can go to you. That's a good kind of starter to remind them that there's support.
Yeah, and that kind of goes to what we were discussing in the report as well, that when people start discussing it more, talking about it more, like you mentioned on social media, people, hopefully it will help reduce that stigma, and will encourage people to, start discussing how they're feeling with other people, not to feel worried they're gonna, burden someone. Like you were saying, you were nervous about, speaking to your parents. And as these conversations start to happen, hopefully we can start to see change. But along that point, I'd love to, hear your thoughts on where you think there might be some gaps in knowledge about mental health, whether it be among, young people, among adults, parents, teachers, or even, media professionals.
Yeah, I mean, I think the biggest gap is that we can't address the mental health system or mental wellness with just one solution. Mental health is not a one size fits all, and our efforts should not try to mimic that. I think we should have a variety of things that support young people, and what helps one young person might not help the other. But I think that's important for us to have an abundance of resources, and resources that are representative of the communities that we're trying to serve, representative of our society. Same with media. I believe that the more we can incorporate people that look like society in media, the more people will feel like there is someone out there, even if they're watching a show that is going through these things, that reminds them of what they're going through, and it may help make them feel less alone.
And to that end, I guess I'm curious if there are any particular narratives that you've seen out there or just good uses of media that have had a conversation about mental health and have implemented these themes, and maybe tell us why you think they were effective.
Yeah, I mean, personally, the top two that come to mind, and I mean, Euphoria was such a big show for this purpose, was because it really exemplifies people struggling with different things, including mental health, addiction, etc. And it does it in a way that has a lot of diverse characters within this show, and it relates. People can relate to it because it's young people acting, right? I love Victor from, I believe it's on one of those paper stream networks, but that show was something that I could relate to because it had a gay young person on there who was struggling with their relationship with their parents going to therapy to understand, etc. So those are some ways, and I mean, there's so many countless examples. I'm trying to think which else. Queens of Gambit as well was a show that did it really well, in my opinion.
There's often a discussion of if social media is the effective conduit to discuss mental health. And I guess I'm curious what your perspective on that is. And, is there social media out there that you think is doing a particularly good job with this?
Social media. I think social media in general offers that opportunity to connect people from the same communities together, right? As a member of the LGBTQ plus community, I've met members of the community that have became really close friends. And we talk often about chosen family within the community. And I feel like we now have this tool, social media, uh, where we're able to connect with other people, where young people are able to connect with young people with similar interests, where people are able to connect with resources specifically for the community that they belong to, whether it's LGBTQ plus, whether it's Latinx resources, etc. I think it's such a unique opportunity to be growing up in this age and to see so many people throughout the various social media platforms using it in a way to inform their peers of resources available to them and for them to share their own stories. I see so many videos of young people using Instagram, TikTok, etc., to narrate what they've gone through. And I think that itself is really helping destigmatize these conversations around mental health. But we need more of them.
Yes, 100%. Social media now, the fact that so many young people are using it, it's helpful and harmful because, we don't want to use too much social media and, start comparing, yourself to other people because that can be, really hurtful. But at the same time, social media is such a powerful tool to have these conversations and to really, give people a platform to discuss what they're feeling or even to learn from, experts in the field and industry and, people who are experiencing similar feelings as well. I guess it would be interesting to understand on the topic of social media and digital, life, where it's so much harder for teens to really, feel that they can have, an easy life without having the need to be connected digitally. COVID, obviously, everyone, switched to the remote life so that, everyone was on it so much more. And, global warming can have negative effects and anxiety. There are so many factors. So how do we as, the younger generation, how do parents, um, you know, again, media professionals, how do we support and help teens who are really struggling with all these, factors that are, making it much harder to, feel positive about yourself?
Yeah. See, I think that's a hard question just because it really depends on where the young person is at and their, I believe if it's a really young person, having the parents really look after how much time they spend on their phones. I see a lot of young children on their phones, on TikTok, on YouTube and stuff. And while it is great to have them entertained in that, I do think there should be some kind of limits per se, so that they're not growing up completely dependent on technology just yet. I do think having more opportunities, activities in person for people to kind of go together, whether it's a screening, right, for a movie, like that stuff is exciting and brings people in person together, but it's also connecting them to that media that people like to see and that they like to be a part of. For me personally, you mentioned so many great things about social media, people comparing themselves and how detrimental that can be to their mental health. I do also agree that COVID really kind of made that even more of a thing for our generation, just because we were forced to basically be away from our peers, et cetera, due to health concerns. But I think the best thing we can do is, yes, limit our use of social media, but also really be mindful of where we're interacting and who we're interacting with on social media. I think for me, I do spend time on social media because it is part of who I am now and what I do. But I try to limit my time on scrolling, just endless scrolling, because it's not productive to me. So instead of just scrolling through my social media 24/7, I do use it, and then I give myself time to listen to music, to go dance, to go on a walk, to go to a cafe, activities, because I do really, and I'm sure most of us do, even those who work from home, miss that kind of interaction with people one-on-one, because oftentimes what I see when I'm using public transportation, when I use it, is people on their phones. And you may be saying hi to someone, but they might not notice because they're on their phone. So I think as a society, being more intentional about how much time we spend on our phones and on social media.
You hit an important point there, which was the decline in mental well-being amongst young people, but amongst a lot across all age groups because of the pandemic and because of social isolation. And I guess I'm wondering, in your own work and in your own advocacy work, how did that change how you reached out to people? And because I guess, like, I'm just wondering, when there are situations in which we can't physically be with other people, how can we still make ourselves present and available and do that work?
That's something that I really was thankful for about, amidst all the bad things of the pandemic. I think something that I learned was that people can come together in these virtual spaces, right? Just how we're doing it now. And it's interactions. Yes, we're using technology, but we're interacting, we're building community. And that's something I saw throughout my work, because I was able to, just for example, I was able to speak in India and in Europe through my own home here in California, which is something I would have never thought would be possible. But more than that, I think the pandemic having such a impact on people's mental well-being, where people were feeling isolated, but they were also staying in touch through their tech. So I think that's something that really entices people to utilize their technology in order to keep in touch with their friends. But in mental health specifically, in the work that I do, I was able to kind of bring people together virtually for peer support groups. And that was something that was really positive for our programming, but also for people who may have not been able to attend in-person events or peer support groups due to a lack of transportation, a lack of Wi-Fi, just whatever it may be. It really presented us with the opportunity to bring people together on a virtual space, just how we're doing now.
And then from there, I think we're just curious, even in a non-COVID space, how have you taken, that seed of, I have to stand up and do something. This was my personal experience growing up, and I don't want other people to be experiencing this. How have you, obviously doing events like this, but also what are other things that you have done in your work, in your personal life, to change conversations around mental health?
Yeah. This is something that I dedicate my life to. I started at 13. I'm 25 now. And it's been, I don't know, almost 13 years now of me doing this work. But I really became invested in doing legislative advocacy work, and forming many advisory boards, councils for Mental Health America, NAMI, doing stuff with JED Foundation, and currently as a Wormline Community Engagement Lead for the Mental Health Association of San Francisco. But really just trying to shift from just having conversations to doing real crucial work of standing up to our legislators, our local officials, in order to really hold them accountable to provide that support for young people. There's so many resources out there, and a lot of people don't know about them. So I think for me, what I've learned is that it tells me the story about our failure to really intentionally outreach to people who may really not know that there's support within their own communities. So I think that's something I've been trying to actively work on. To give you even more of a specific example, prior to moving out of Woodland, California, where I grew up in, to pursue my education in San Francisco, I was feeling a huge responsibility to change things in my community that made me feel really depressed and anxious at the young age. As I mentioned, I was being bullied because I was gay, and I wanted to shift and have a really big conversation on supporting the LGBTQ plus community with resources and with a message of affirmation by the community. I emailed our city council and drafted a proclamation for my hometown that made history and it passed for the first time in the town's history, that addressed Pride Month for the very first time, and it also bolted resources for our LGBTQ plus community here in town.
So taking that work that you've done in the past, what more do we need to do? What if you could, wave your magic wand of legislation at the state, local, national level? I know you were at the White House with the Surgeon General and First Lady Jill Biden. So you've already been on that stage, but I think if you could get them to do anything at all of these different levels, what do you want to see?
I want to see more preventative resources for mental health. I think the earlier we can start educating people on mental health, mental wellness, providing young people in school and elsewhere more activities, more resources, whether it's yoga, whether it's dance, all these things that can be really of support to young people. That's important. Staffing schools with more counselors, that's important as well. And also seeing the media address it even more frequently. I had a question not too long ago asking me if it was oversaturated addressing mental health in media. And I was like, absolutely not. Like, we need more and more conversations and more representation of these things in media, because I mean, it's very real issues that people are undergoing, especially now. So while I have done a lot of work and while I've been on many stages, I believe it's really important for us to continue putting out resources, looking at our current resources, identifying what hasn't been working, looking at our media efforts as well, what has been working, what hasn't been working, and continue addressing until we get it down.
Yes, of course. Sometimes, with so much going on, it's like we forget that we have to, continue to speak about and continue to address, everything that's going on. So 100% reminding people, how can we start before the problem? How do we prevent it? Before it's too late? And of course, it's very good to highlight all the resources and tools to help people, but we also want to help people before they even get to that stage. So 100%.
Yeah. And I mean, the world changes so much, if I may add just that. And I think regardless of how much funding that has been put forward for mental health or not, we constantly need to be looking at our current situation. And I always look at it in that way in the work that I do. And my approach is that, yes, we have that now, but something is bound. 2 years from now, we're going to be in a completely different space as a society. There's going to be a lot of new things. How are we going to constantly keep addressing, and how can we do something that's sustainable to address those things as they come up as well?
Right. Like COVID, nobody knew COVID. That came out of nowhere, right?
Exactly.
And then, people were forced to adjust, and, how can we help people right now? Because it still is a scary time. So 100%, yes, things are always changing and resources are changing. And, the younger generation, they're very quick as well. So got to stay up to speed. But I guess on that note, if you had an audience of, executives from different networks or streaming services or social media platforms, with media geared towards youth specifically, what would you tell them? What do they need to know? Because, being in the older generation, you might not have, the same opinions or outlooks or, recommendations. So what would you advise them?
I would say keep doing mental health work in terms of really addressing it in media. In addition to that, when you are addressing it, make sure it's representative of society, as I mentioned. Really uplifting underserved communities is really important, as we've seen with LGBTQ plus statistics, with BIPOC statistics. These people are really struggling, and I believe the more we can have kind of that representation in media will be really helpful for people. And lastly, asking the youth what they would like to see too. I know it's really complicated to at times really gather people together and have that, but even like doing like a quick survey of like, what would you like to see, or part of your, I guess, creative process, inviting those young people to try and inform some of that production that you're working on or something that you're trying to push out will be important, because this, I hear it so often when I'm with other young people. It's like nothing about us without us. And I think it's something that really people resonate with, because for years, people have just been handed resources and it's just an offer, but it hasn't been intentional. So in order for it to be intentional, we need to reach out and really invite them to be a part of the process.
And I think that's an important point to highlight, that young people do want to see stories about mental health. It's not something that, you would have to force them to watch. I think they want to be able to see relatable experiences to what they are going through. And actually, our friends from the Center for Scholars and Storytellers, they did a report where they, just like you said, they kind of brought in those younger voices of the younger generation, and mental health was in their top like topics or themes that they wanted to see TV or movies and characters going through. Um, just to pivot a little bit, we know mental health in general can be a very gloomy topic, especially when we look at the statistics that are in our report. And I just want to know, because you're out there actually talking to people and seeing the work that is being done, what brings you hope in this space?
Yeah, I mean, I'm really hopeful to see the amount of conversations that we're having in media and with young people themselves, seeing people from all ages, as you mentioned, but specifically young people really be leading this fight in this conversation is something that inspires me, because, I don't know if it was the time that the older generations were growing up in, and it was probably more stigmatized and people repressed a lot and didn't share how they were feeling. But now to see young people really be so open on social media and talk about things that they underwent and how they became so resilient and how they received support inspires the other young people who will be growing up after them to do so the same. And the amount of funding for mental health resources is really inspiring, and the amount of people trying to support other people. I think, yes, life has been so wild for so many years now, and there's a lot of things that still aren't perfect, but something that I've really seen an increase on, at least digitally, is people looking out for one another and trying to be there for one another.
Yes, that's well said. It's so nice that people are, becoming more open, and, it is something that people are starting to talk about. It's really, hopefully going to become the norm, which, if it's not already, we hope that, down the line, with everything going on, resources coming out, research being done, people speaking up, we can reduce the stigma and eventually make sure that everybody can, feel, good about themselves. And if they're not, they know where to go to, um, you know, get to their best place.
It better become the norm. It better become
One day, right?
yes. Even if I'm like, I don't know, 90, I'll still be there if it's still a stigma around it, but I hope not. I hope not.
Well, statements like that gives me hope that people like you are still going to be like fighting for as long as, you're alive, to make sure that, young people and all people know that they're loved and taken care of and that they matter.
It's something I take seriously. It's not, I don't even look at it as like my job, or again, like it just became something that was a part of my survival. And I just hope I'm able to reach people and remind them, at least a couple, that they're not alone and that there's support out there.
Right. Saving one life, saving a generation. So yes. We'd love to open the floor to the audience if they have any questions and they want to put it in the comments. Or Juan, if you have anything else that you'd like to bring up, we'd love to hear it. But that's it from Betsy and I in terms of questions.
Great, thank you.
I had a quick question. I just wanted to ask, talking about your sort of personal advocacy, and I know you said from the beginning that you hadn't really intended to get into it. So how do you, now that this is really a part of your life, how do you kind of find that balance between being your own person and doing your own life, but also being such an advocate for it when people look up to you?
I think it took a long time to really find that balance. And to be honest, I probably still struggle with some of those boundaries till this day. And that's just because I'm so deeply invested in it. And it just became such a huge part of my life. But I balance it by really surrounding myself by loved ones, by spending a lot of time with my friends, my family, and still setting intentional time to live my life. I mean, I'm young still, and I'm trying to do a lot of things that I hope help change the mental health space, but I'm also trying to enjoy my life. And I think that's something I have to remind myself for a while, that I can't always feel 100%. I still struggle. While recovery isn't linear, and I may feel down some days, and that's okay. So I think really being self-aware and honest with myself and setting boundaries with others and with myself as well. This is the amount of time I will set aside for this today, and tomorrow it'll be different. I'll take more time for myself, for my own life. And I think that's something that helps me a lot.
I love that. I love the point about being honest with yourself, but then also surrounding yourself with your family and friends. That's really important.
Yeah, because being honest with yourself isn't always the best thing, at least not in my head. I'm just like, really my biggest enemy. But no, it really it goes back to just accountability and making sure that you find that balance. And balance is so important in whatever that you do. So it took a while, but I'm getting there.
Well, thank you. Thanks for answering.
Thank you.
And then I think, just for anybody watching, I would love for you to plug yourself in terms of where people can follow your work and the people that you're meeting and talking to, and the work that you're amplifying across your platforms.
Yeah. Well, as mentioned earlier, my work focuses just general mental health, but I do talk a lot about my identity as a LGBTQ plus community member and as a Mexican immigrant. You can follow me at Juan Acosta with 2 underscores on all social media. And you can visit my website at www.juanacostaofficial.com.
Awesome. Well, it was really such a pleasure to talk with you tonight. Your work is really inspiring. Like I said, it's the thing that is giving me hope amidst all of this, the work of people like you. The people who are willing to engage in these conversations about something that is not rosy and not always the easiest to talk about, but it does help build those bridges and form those connections, so other people can feel more comfortable coming forward with their stories and struggles.
Well, thank you. That's really kind of you. And for anyone watching, I just want to encourage to really reach out to people if you are struggling, and to share resources as well with your loved ones who might need it if you have the opportunity to do so.
Thanks so much, everybody.
Thank you.